Welcome to the lecture on posterior forearm muscles. All the posterior forearm muscles are innervated by the radial nerve or a deep branch of the radial nerve called the posterior interosseous nerve. All of the superficial posterior forearm muscles originate from a common extensor tendon on the lateral epicondyle of the humerus. There are a total of 10 posterior forearm muscles. They are divided into two groups, the superficial muscles and the deep muscles. The superficial muscles include the extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum communis, extensor digiti minimi, and extensor carpi ulnaris. The five deep muscles are the supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. The extensor retinaculum is an oblique band of connective tissue at the wrist that holds the extensor tendons in place as they course over the carpal bones into the hand. It has extensions that attach to the carpal bones, forming 6 compartments at the wrist. The dorsal tubercle, on the dorsal side of the distal radius, lies between compartments 2 and 3. The table shown in this slide lists the 10 posterior forearm muscles and the compartment through which their tendon courses through at the wrist. Notice that the supinator does not have a tendon that courses through the wrist and therefore has none labeled. Now let's go through the attachments, joint movements, and innervation of the 10 posterior forearm muscles. Extensor carpi radialis longus. Its proximal attachments are the lateral epicondylar ridge of the humerus and the lateral epicondyle. The muscle courses down the forearm and then extends a tendon through compartment 2 at the wrist to attach to its distal attachment at the base of metacarpal 2. It performs elbow flexion, radial ulnar joint supination, and wrist extension and radial deviation. Its innervation is the radial nerve. Pause the lecture to label the muscle attachments and draw in the muscle belly. How does your drawing compare? Notice that the tendon courses lateral to the dorsal tubercle, putting this tendon in compartment 2. The proximal attachment of extensor carpi radialis brevis is the lateral epicondyle of the humerus. The muscle belly courses distally, and then the tendon continues through compartment 2 at the wrist to attach to its distal attachment at the base of metacarpal 3. Extensor carpi radialis brevis performs radial ulnar joint supination and wrist extension and radial deviation. The innervation of extensor carpi radialis is the radial nerve or its deep branch called the posterior interosseous nerve. Pause the lecture to write in the muscle attachments and draw in the muscle belly. Remember, its muscle tendon is in compartment 2, which lies lateral to the dorsal tubercle. How does your drawing compare? Extensor digitorum, also called extensor digitorum communis. Its proximal attachment is the lateral epicondyle of the humerus. Its distal attachment is the proximal phalanges of digits 2 through 5. The extensor digitorum also has distal attachments to the extensor mechanism of digits 2 through 5 to the middle and distal phalanges, as well as the dorsal hood expansion of digits 2 through 5 at the metacarpal phalangeal joint and the proximal phalanges. The extensor mechanism is located on the dorsal aspect of the hand, and it is a combination of the tendon of the extensor digitorum as well as the tendons of the interosseous and lumbrical muscles, which we will cover when we talk about the intrinsic muscles of the hand. The dorsal hood expansion is a triangular connective tissue expansion that connects the interosseous muscles of the hand, I should say the tendons of the interosseous muscles, to the tendons of the extensor digitorum. The dorsal hood expansion is located on the dorsal aspect of the hand that covers the MCP joint and the proximal phalanges. Extensor digitorum performs wrist joint extension and ulnar deviation. Metacarpal phalangeal joint extension of digits 2 through 5, and weak extension at the proximal interphalangeal and distal interphalangeal joints of digits 2 through 5. True extension at the PIP and DIP joints occur through the hand intrinsic muscles. The innervation of extensor digitorum is the posterior interosseous nerve, which is a deep branch of the radial nerve. Go ahead and draw in the muscle attachments as well as the muscle belly. Remember that the tendon of extensor digitorum will course through compartment 4 and then split to go to the individual digits. How does your drawing compare? Notice that at the distal portion of the phalanges, you see the extensor mechanism drawn in on this drawing. Extensor digiti minimi. The proximal attachment is the lateral epicondyle of the humerus. The distal attachment is the middle and distal phalanges of digit 5. The muscle belly courses medial to the extensor digitorum, and the tendon of extensor digiti minimi courses through compartment 5. Extensor digiti minimi performs wrist extension and ulnar deviation, metacarpal phalangeal joint extension and abduction of digit 5, as well as some extension of the PIP and DIP of digit 5. Again, in order to produce extension at the PIP and DIP joints, the muscle needs assist from the interosseous muscles. Extensor digiti minimi is innervated by the posterior interosseous nerve, which is a deep branch of the radial nerve. Pause the lecture and go ahead and draw in the muscle attachments as well as the muscle belly. How does your drawing compare? Also note that the extensor digiti minimi has an attachment to the extensor mechanism of digit 5. Extensor carpi ulnaris. Extensor carpi ulnaris's proximal attachment is the lateral epicondyle of the humerus. The distal attachment is the base of metacarpal 5. Its muscle belly lies medial to the extensor digiti minimi, and its tendon courses through compartment 6. Extensor carpi ulnaris performs wrist extension and ulnar deviation. The innervation of this muscle is the posterior interosseous nerve, again, which is a deep branch of the radial nerve. Please pause the lecture to draw in the muscle attachments and the muscle belly. How does your drawing compare? Supinator. We have already covered supinator in the muscles of the forearm. So for review, its attachments are the lateral epicondyle of the humerus, the supinator crest of the ulna, and the proximal 1/3 of the radius. The supinator performs radial ulnar joint supination, and its innervation is the posterior interosseous nerve, a deep branch of the radial nerve. Pause the lecture to see if you can remember how to draw supinator. How does your drawing compare? Remember that supinator does not course through the wrist and therefore does not have a compartment. Also remember how the supinator muscle attaches at the supinator crest and then wraps posteriorly around the radius. This is a posterior view of the elbow and forearm. Go ahead and try to draw in how you would envision the supinator with its attachments and its muscle belly on the posterior aspect. How does your drawing compare? Can you see from this drawing how this muscle, when it contracts, would perform supination? Abductor pollicis longus. Its proximal attachments are the posterior surface of the radius and ulna, as well as the interosseous membrane. Its distal attachment is the base of metacarpal 1. Abductor pollicis longus's muscle belly lies deep to extensor digitorum and extensor digiti minimi. The muscle belly courses laterally from the ulna over the interosseous membrane to the radius, with its tendon at the wrist passing through compartment 1 and then attaching distally to the base metacarpal 1. Abductor pollicis longus performs wrist joint flexion and radial deviation, as well as abduction, extension, and opposition at the carpal metacarpal joint of digit 1. Its innervation is the posterior interosseous nerve, which is a deep branch of the radial nerve. Go ahead and pause the lecture to draw in the muscle attachments as well as the muscle belly. How does your drawing compare? Extensor pollicis brevis. Extensor pollicis brevis's proximal attachment is the posterior surface of the radius and the interosseous membrane. Its distal attachment is the proximal phalanx of digit 1. This muscle belly lies deep to extensor digitorum and extensor digiti minimi. It also lies medial to the abductor pollicis longus muscle belly. Its tendon courses distally through compartment 1 with abductor pollicis longus. Extensor pollicis brevis performs flexion and radial deviation at the wrist joint, extension at the CMC joint of digit 1, and extension at the MCP joint of digit 1. Extensor pollicis brevis is innervated by the posterior interosseous nerve, which is the deep branch of the radial nerve. Go ahead and draw in the muscle attachments and its muscle belly. How does your drawing compare? Extensor pollicis longus. Extensor pollicis longus's proximal attachment is the posterior surface of the ulna and the interosseous membrane. Its distal attachment is the distal phalanx of digit 1. The muscle belly of extensor pollicis longus again is deep to the extensor digitorum and is also medial to the extensor pollicis brevis muscle belly. Its tendon is medial to the dorsal tubercle of the radius and goes through a compartment all of its own called compartment 3. Extensor pollicis longus performs radial ulnar joint supination, wrist joint extension and radial deviation, carpal metacarpal joint movement at digit 1 into extension, adduction, and reposition, extension at the metacarpal phalangeal joint of digit 1, and extension at the interphalangeal joint of digit 1. Extensor pollicis longus is innervated by the posterior interosseous nerve, which is a deep branch of the radial nerve. Pause the lecture to go ahead and draw in the muscle attachments and its muscle belly. How does your drawing compare? Note that the tendon courses medial to the dorsal tubercle of the radius. Extensor indicis. The proximal attachment of extensor indicis is the posterior surface of the ulna and the interosseous membrane. Its distal attachment is the posterior surfaces of the middle and distal phalanges of digit 2 via the extensor mechanism. The muscle belly of extensor indicis lies deep to the extensor digitorum and medial to the extensor pollicis longus. Its tendon courses through compartment 4 to attach at the middle and distal phalanges of digit 2. Extensor indicis performs supination at the radial ulnar joint, wrist extension, metacarpal phalangeal joint extension at digit 2, as well as extension at digit 2 of the PIP and DIP joints. Again, extension at the PIP and DIP joints must be assisted by the interossei muscles. Extensor indicis innervation is the posterior interosseous nerve, which is a deep branch of the radial nerve. Please pause the lecture to draw in the muscle attachments as well as the muscle belly. How does your drawing compare? Remember to include the extensor mechanism. A common pathology that we see involving the posterior forearm is called lateral epicondylitis. This is also known as tennis elbow. This is an inflammation of the common extensor tendon, most often involving the extensor carpi radialis longus and extensor carpi radialis brevis muscles. This pathology is typically due to overuse and poor body mechanics during activity. Let's talk a little bit more about the median and radial nerves and their branches. If the median or the radial nerves are cut, this means that all of its branches are affected as well. Keep this in mind when answering the cut the nerve questions. The median nerve branches into a superficial and deep branch. The deep branch is called the anterior interosseous nerve. The superficial branch supplies motor function to the superficial anterior forearm muscles and motor and sensory function to the hand. The deep branch supplies motor function to the deep anterior forearm muscles. So if the median nerve is cut or damaged, all function, motor and sensory, of the superficial anterior forearm and deep anterior forearm invaded by the median nerve would be lost. If the injury occurred to the deep branch of the median nerve after it split, then the sensory function of the forearm and hand, as well as motor to the hand, would be intact, but the motor function to the anterior deep forearm muscles would be lost. The radial nerve branches at the elbow into the superficial radial nerve and the deep branch called the posterior interosseous nerve. The superficial radial nerve provides cutaneous sensation to the posterior forearm and hand. The superficial radial nerve does not provide any motor function. The deep branch of the radial nerve supplies motor to all the posterior forearm muscles, starting with supinator. This does not include the extensor carpi radialis longus muscle, as this muscle is innervated by the radial nerve and not the deep branch. When it comes to extensor carpi radialis brevis, this muscle's innervation can be variable and can include innervation from the radial nerve or the deep branch.